Wechsler's Intelligence Scale for Children, WISC, is a widely used and respected cognitive ability assessment tool designed for children and adolescents aged 6 to 16 years old. Developed by David Weschler, the WISC is currently in its 5th edition, WISC-IV, released in 2014. This test is used by psychologists, educators, and clinicians to evaluate a child's cognitive abilities and intellectual functioning. Process 1. Administration. The WISC is administered individually by a trained professional, typically a psychologist or a licensed clinician. The test takes approximately 65–80 minutes to complete, depending on the child's age and abilities. 2. Subtests. The WISC-IV consists of 10 primary subtests and 5 secondary subtests. These subtests are grouped into different index scores: A. Verbal Comprehension Index, VCI, B. Visual Spatial Index, VSI, C. Fluid Reasoning Index, FRI, D. Working Memory Index, WMI, E. Processing Speed Index, PSI. 3. Scoring. Each subtest is scored individually, and then the scores are combined to calculate the index scores and the full-scale IQ, FSIQ. 4. Interpretation. The psychologist interprets the results, considering the child's performance across different subtests and indexes, as well as any discrepancies between scores. Application 1. Diagnostic purposes. The WISC is often used as part of a comprehensive evaluation for learning disabilities, attention deficit, hyperactivity disorder, ADHD, intellectual giftedness, and other cognitive or developmental issues. 2. Educational planning. Results from the WISC can help educators develop appropriate educational plans and interventions tailored to a child's cognitive strengths and weaknesses. 3. Clinical assessment. The test is valuable in clinical settings to assess cognitive functioning in children with various neurological or psychiatric conditions. 4. Research. The WISC is frequently used in research studies examining cognitive development, intelligence, and various childhood disorders. 5. Gifted program placement. Many schools use WISC scores as part of their criteria for placing students in gifted and talented programs. 6. Progress monitoring. The test can be re-administered after a period of time to assess a child's cognitive development or the effectiveness of interventions. 7. Legal and forensic applications. In some cases, WISC results may be used in legal proceedings involving children, such as custody disputes or juvenile justice cases. 8. Career guidance. For older children, WISC results can provide insights into potential career paths that align with their cognitive strengths. It's important to note that while the WISC is a valuable tool, it should not be used in isolation. A comprehensive assessment of a child's abilities should include other measures, such as academic achievement tests, behavioral observations, and input from parents and teachers. Additionally, cultural and linguistic factors should be considered when interpreting WISC results, as the test may not be equally valid for all populations. The WISC continues to be refined and updated to reflect current research in cognitive psychology and to address concerns about cultural bias. Its widespread use and ongoing development make it a cornerstone in the field of child cognitive assessment.